So thanks to the project for the opportunity to join you all on this unusual online consultation and to offer some reflections on one of the proposed indicators. So I've been asked to look at construct 4.2, which is a new proposed indicator. The indicator is to verify that the National Health Plan includes the right to respectful maternity care, or RMC. In the EPMM phase 2, this was formulated as respectful maternity care as a right in the National Health Plan. So in trying to clarify this construct, I think there are two key elements. One, of course, is respectful maternity care, but the second one is as of right, or the right to RMC. So I think we could state the underlying construct to be measured here as trying to measure a rights-based dynamic, that is a relationship of obligation and entitlement between a duty bearer and a rights holder that generates a positive, dignified, respectful birthing experience. And in this case, the duty bearer is the government, the health system, and health workers, and the rights holder is birthing women, so, and their families. So I would say that the verification of the right to RMC in a national plan should be relatively simple to do. I mean, it really just requires finding the plan, reading it, and seeing if the right is stated in the national plan. The small wrinkle comes with the question whether it's the exact words respectful maternity care that we are trying to verify exist, or are we looking for the substance of RMC domains, or perhaps the substance of mistreatment domains that would then be recognized as a right to avoid those things? To my knowledge, there's no current comprehensive compendium of RMC or RMC-related policies. Nevertheless, this would not be that difficult to measure in any given country. When we look at this indicator, though, there are a number of assumptions built into what a one-time statement of this right in the national plan would be doing. It assumes that statement is indicative, first, of the very existence of the right, and secondly, of the government's intention and action to implement the right, and finally, the exercise and enjoyment of the right. So all of those things are assumed here. So let's look at some of those. First, is the National Health Plan the correct place to verify that the right exists? National health plans, policies of this sort, do not actually create enforceable rights. It's legislation that creates enforceable rights. So a national health plan is really more accurately a statement of government intent than it is a document creating rights. Now, it's true that many countries have adhered to human rights documents and treaties, and at this point, human rights norms have been interpreted to include RMC as a right. But national legislation is usually needed to formalize the operation of the right in law. So in short, a statement in a national health plan does not actually verify the existence of the right in law, of an enforceable formal right. We should also ask whether having such a statement of the right to RMC in a national health plan is likely to correlate with government actions that are needed to implement that right to RMC. And here, all of our experience with rights and human rights in maternal health tell us that generally, simply having a statement in policy endorsing a right is rarely enough to um, ensure, or it rarely correlates standing alone with government actions to actually enforce that right. So this is why, for example, despite the fact that the right to survive preventable maternal, to survive in pregnancy, to reduce preventable maternal mortality and morbidity, even though this has been acknowledged in human rights law for many years as a right, the High Commissioner of Human Rights and the Human Rights Council recognize that there was a need for fairly elaborate technical guidance on how a rights-based approach to such policies and the implementation of them, there was a need for guidance on this, that a simple statement was never going to be enough to ensure that the right was either implemented or enjoyed. And sure enough, the most recent report by the Special Rapporteur on Violence Against Women last year in 2019 reported on really widespread violation of a right to RMC. She called it obstetric violence or mistreatment of women, despite clear recognition of that right to RMC in the human rights norms. We can also look at the evidence that has been systematically reviewed by the WHO as the basis for its guidelines on intrapartum care for a positive birth experience. And these guidelines do, the first guideline is about the provision of RMC. And while the evidence was deemed strong enough to recommend RMC, none of this evidence that was found in the literature actually is about the effectiveness of a policy in a national health plan. The policies that Sue Down et al. Reviewed, the studies that they looked at were entirely facility-based policies. So there is no evidence that I'm aware of that simply having a statement alone is effective to create progress in respectful maternity care. So this leads to the question of the interpretability and usefulness of this kind of indicator. So we should recognize that verifying that a right to RMC is in a national health plan is a one-time yes/no question for a multi-year plan. So that means that this is an indicator that would be of little use in monitoring because it would not vary over the period of the plan, even if government action to implement the right was dramatically improved or dramatically worsened. Similarly, the indicator would not vary, even if violations of the right dramatically increased or dramatically reduced. So I think both its interpretability and its usefulness are problematic. But we could think of this, how does it harmonize with other rights? And I would say it's not that itself is a problematic step. In fact, the endorsement of the right to RMC in a national health plan is probably a necessary, but far from sufficient step to generate conditions for the fulfillment of the right. So, for example, the National Health Plan, including this right, was part of the technical guidance of the High Commissioner for Human Rights, but it was not the only thing in the guidance. So the problem is when this stands alone as an indicator. Standing alone, I think it actually risks rights washing, mistreatment. That is creating the false impression that the government is actually acting to guarantee RMC if this is the only thing it does, because we know that the simple statement of a right um, goes a very short way towards the actual implementation and enjoyment of the right. So this raises the question, of course, of whether there is a point to measure along the continuum of actions that are needed to go from a formal law to a government policy to an actual practice and actions to ensure a right to RMC. Is there any single point along that line that is more sensitive to the government actions that we are trying to promote and monitor? I don't think we have a full answer to that, but I would summarize my reflections on this by first saying absolutely RMC should be part of an EPMN indicator set. I think there's no question that it is an element of maternal health and the prevention of maternal mortality and morbidity that absolutely needs to be in a indicator set going forward. Similarly, looking at RMC as a right adds a very important human rights dimension to the indicator set. And so I endorse the idea of seeing RMC as a right. But all of this experience with rights and guidance on how to implement a rights-based approach, and also the evidence that is in the health literature that was reviewed for WHO, certainly implies we need multi-component or multi-level interventions to tackle RMC. I know the EPMM phase 2 has another indicator proposed on pre-service education, but I think similarly, this captures one dimension of action to promote RMC, education, that is also necessary, but we know very far from sufficient, because RMC requires not just a change in a health provider's mindset or knowledge, but also change in the system in which they work. So I agree, we also need a policy or structural level indicator for RMC as a right to complement that indicator on healthcare worker education. Nevertheless, the simple verification of a statement of a right in a multi-year plan, I fear adds very little to the indicator set that's being used to monitor progress. So I would challenge us to reach back again and see if we can come up with some indicator that at least can reflect to some degree ongoing government action to create the conditions for the enforcement of the right, or ongoing citizen action to exercise the right, or even ongoing evidence of people's enjoyment of the right. I think any of those would reflect better whether the government is actually doing something serious to try to implement policies and practices that will support enjoyment of respectful maternity care as a right. Thank you.